Currently, there are 911 cases of dengue nationwide and 9 deaths. However, Tobago has not experienced any deaths due to the virus. Secretary for the Division of Health, Wellness and Social Protection, Dr. Faith B. Yisrael, shared symptoms of severe dengue that persons should be on the lookout for. She spoke on Tobago Update's Good Morning Tobago program. Ariana Scipio has the details.
Health Secretary Dr. Faith B. Yisrael said the symptoms of severe dengue are belly aches, tenderness, persistent vomiting such as 3 times a day, and bleeding.
If you notice that you're bleeding in the nose, bleeding in your gums, you have blood in your vomit, blood in your stool, and extreme tiredness. So going back to the blood, remember when we are talking about dengue, the term that we also hear is dengue hemorrhagic fever, hemorrhagic meaning bleeding.
Dr. B. Yisrael said if it got to the point of bleeding, medical attention was needed, noting that internal bleeding can lead to death.
If we get to that point, it means that your organs have begun to not function the way they should. They've begun, in essence, shutting down, and that is where we usually lead to death.
She explained while people with mild symptoms in Trinidad are seeking medical attention due to the high number of deaths, Tobago, having had no deaths, can manage mild cases at home to prevent overwhelming the healthcare system.
So if you have the common symptoms, the headache, the body ache, the slight nausea, maybe vomiting once, the slight little rash and the pain behind your eyes, and you think that you can manage that at home on your own, you can do so.
She said what this also means is that there may be mild cases of dengue that are not accounted for since it is not being reported to a health facility. She also said that awareness of the virus is also being spread through various media appearances and speaking to community groups such as churches and sporting groups. Ariana Scipio, Tobago Updates Television News.